Petitions from the public on legislation.
I have Wendy Hyde.
I'm going to spin that around. Look at that. A woman on the move.
Good evening. I'm Wendy Hyde, and I represent the Preventing Tobacco Addiction Foundation, Tobacco 21, and I'm
Ma'am,
here this evening.
If you can tell us your name and your address for the record, please.
Sure. Yeah, sorry about that. Wendy Hyde, 260 Rebecca Lane, Brunswick Hills, Ohio, 44212.
Thank you.
So I'm here this evening representing the Preventing Tobacco Addiction Foundation, Tobacco 21. I'm here to show my support or state my support for the proposed ordinance number 119-222 and ordinance number 120-222 intended to restrict the locations and density of vapor and smoke shops in Brunswick. As a tobacco control policy expert, I would like to offer my support and assistance with policy adoption. I'm the regional director for the Preventing Tobacco Addiction Foundation. We are a national organization specializing in tobacco control policies aimed at protecting children from these deadly products. PTAF has led the fight in raising the minimum sales age to 21, and our organization is now paving the way for the adoption of tobacco retail licensing at local, state, and federal levels. My interest in Brunswick's policy goes beyond the scope of my employment. As a Brunswick City resident, I am the parent of 4 children who are currently or have attended Brunswick City schools. We consider Brunswick City proper as our home. In fact, my career in tobacco prevention and cessation began about 7 years ago when I picked up my oldest son, who was 13 at the time, from Byzantiner Middle School after basketball practice. He entered the car and he asked the point in question, he says, "Hey Mom, do you know what e-cigarettes are?" And I was a K-12 PE health teacher at the time, and I said, "Yeah, I know what they are." And he said, "Well, some kid was selling them out of his locker today for $10. Once he got home, he asked my husband the same question. "Hey Dad, do you know what e-cigarettes are?" His reply was, "Well, I kind of know, but not too much." Soon after this incident, several parents and friends began reaching out to me as a health professional with similar questions. This encounter made me realize that my son and his peers were unaware of the harm. Parents and adults were in the dark about the addictive nature of these flavored tobacco nicotine products. And as statistics show, we thought that we had won the war on tobacco back in the late 90s and early 2000s. And as statistics showed, we were at about an 8.9% of youth who were using tobacco products about in the previous 30 days in 2013, 2014. In 2022, those same statistics gathered by the Center for Disease Control show that we have doubled our nicotine addiction among our youth. We are at about 16.5% of current youth using tobacco products in the last 30 days. Further, despite my work in tobacco control, having open communication with my son, educating him about the harms, and instilling protective factors in our family life, he still fell victim to the vaping epidemic in this prodigious industry. His introduction to these addictive products were further enabled by the ease of access. At 16, he easily bought flavored vape products at a local vape shop. My husband and I have called and gone into these shops on several occasions, knowing that they were the dealers supplying our son with this illegal and deadly product. One dealer told me that my son was part of the preferred customer list among the chain of stores. So they didn't check his ID. Mind you, he was 16. The legal age was 21. I want to change the way tobacco and vapor retailers do business within our city limits. And I believe the ordinance that you are proposing, coupled with a comprehensive tobacco retail license, or TRL, is the best solution to protect Brunswick youth from this insidious industry. The effectiveness of a tobacco retail program is that they approach this problem as a public health issue and specifically focus on the retailer, not the clerk, or the kid or the child who
Ma'am,
is
you have 30
addicted to
seconds.
nicotine. An effective TRL would require every tobacco retailer in Brunswick to get a license and renew it annually. It would fund robust enforcement efforts with the annual retail compliance checks. It would hold retailers accountable for unlawful sales to youth through graduated penalties and license suspensions or revocation for repeated offenders. Lastly, I want the City Council efforts in Brunswick. I want to thank you for your efforts in protecting this generation, and I urge you to consider taking steps to adopt an ordinance around a tobacco retail license to couple the current work that you're doing, and I applaud those efforts. Thank you. Your leadership is needed now more than ever to protect the kids from a lifetime addiction to nicotine. Thank you very much.
Thank you, ma'am.
Rebecca Parkhurst.
Good evening, Rebecca Parkhurst from the Medina County Health Department at 4800 Ledgewood Drive in Medina. Dear Brunswick City Council members, my name is Rebecca Parkhurst and I'm employed as a health educator for the Medina County Health Department. I'm here this evening to comment on public health data regarding the proposed ordinance numbers number 119-2022 and number 120-2022, intended to restrict the location and density of vapor and smoke shops here in Brunswick. In working with youth, I've had the opportunity to speak with many students who are struggling with really high levels of dependence and addiction to tobacco products. The most striking story I heard recently was of a young lady who would vape the equivalent of 12 packs of cigarettes worth of nicotine in just 4 days. And that story really hit home for me and gave a very clear picture of the difficulty that our youth are facing when it comes to these products and the increasing level of addiction that they are facing compared with other traditional tobacco products. Comprehensive tobacco policies are considered highly effective, very evidence-based initiatives that historically have been very successful in terms of strategies in public health to address tobacco. For example, tobacco retail licenses have been shown to result in 95% compliance rates in areas where they're successfully implemented. Zoning policies have also been shown to reduce the amount of marketing the youth are exposed to as well. In conducting compliance checks over the last 2 years here in the Brunswick area, we've observed multiple underage sales at vapor or smoke shop locations within just 1,000 feet of schools. In some cases, we've witnessed sales knowingly and intentionally made to underage individuals. Current compliance rates with Tobacco 21 laws in the city of Brunswick is at 68%, leaving nearly a third of stores non-compliant with Tobacco 21 laws that are statewide. About 37% of youth obtain their vapes from a vape shop or a gas station, with an additional 25% getting their vapes from a friend. Altogether, this means that about 62% of youth vape purchases could be prevented by tobacco control policies to prevent this youth access, and that number could be even higher depending on what type of policy is implemented and the strength of it. While the public health implications of adult use of vapes and e-cigarettes are still needing a lot more longitudinal research to fully paint the picture of the health outcomes, we know that in Medina, the main purchasers of vape products are youth. Only 2.5%, roughly, of Medina County adults report using vape products, whereas among youth, that number is much closer to 15%. And as many of my colleagues in the schools have mentioned, they estimate that number is much, much higher, and that is underreported. So between these numbers and the repeated historical evidence from tobacco industry marketing strategies, it's very clear that youth are the target audience for these products. So youth vaping continues to be an enormous challenge that faces our communities, addicting an entire new generation to nicotine who never would have considered smoking. In closing, I want to thank you for your attention to youth vaping and protecting the health and well-being of the Brunswick community. Thank you.
Thank you, ma'am. We'll now commence the reading and action on legislation. Madam Clerk.
Ordinance 119.